is not a new disease, it is a very old disease. In olden days, there was no cure for TB. But with the advance of medicine, TB was curable. So in Western countries, TB was almost eliminated. But then with the advent of HIV pandemic, TB again became a problem. So with that, if you look at the world scenario, it is said that 10 billion people are being affected by TB every year, 10 million people. And in India alone, we contribute 2 million for TB per year. So if you look at TB scenario, it is something which is a very big burden to our people, as well as to our economy, our finances. So with that, government has come up with the initiative of National TB Elimination Program. Because we are spending so huge resource of our finances on this aspect because of treatment of TB. So now that TB is curable, the government of India thought that TB can be eliminated. So the World Health Organization has targeted 2030 for World TB elimination. But the government of India thinks that with too much of TB cases in India, it will be too late if we wait for the global TB elimination. So 5 years ahead of global TB elimination, we are planning to eliminate TB by the year 2025. So with that concept, even Nagaland also now, we have gone into full campaign mode. Previously what we do is we wait for the patient to come to us so that we can diagnose them and treat them. But now we are going house to house, door to door, in search of this active case finding. We call it active case finding. So now with only a few more years, another 1.5 years to go for this TB elimination in India, we are in active campaign mode. So to come to this TB specifics, I'm sure that all of you must have read it in papers or must have had conference like this or in some seminars heard about this TB, what is TB, how it is spread, all these things like that. TB, as we all know, it is a respiratory disease. It is a acute infectious disease. It is caused by droplet infection, just like what we have experienced a few years past, the COVID pandemic. It is spread through droplet infection. So that's why it is very dangerous. If you look at HIV, it is spread, the mode of spread is different, so we can control. But TB, it is spread through droplet infection. So no matter how careful you are, unless we try to reduce the case of TB or we eliminate TB, there is still chances of us getting TB, since it is a droplet infection. So TB is caused by droplet infection, and once a case of open TB case, that is pulmonary TB case, if they coughed out, like here in a meeting like this, if a person with a TB coughs out, since it's a droplet infection, he expels the bacteria into the environment. And anyone surrounding that can inhale that bacteria. It goes inside our lungs, and depending on the immune status of the person, TB can develop, TB can start in the particular person. So I'm going to detail later on how this mechanism comes about. But that's to do with the spread of TB. It is a droplet infection, and after this infected patient coughs out, that's how it's spread in the environment, and it enters our respiratory system, and there it gets lodged. And there it causes, it stays there in our body. Later on, that's the concept of TPT. Okay. All of us at one point of time, we are exposed to this TB bacilli. But all of us do not develop the disease. Only certain people develop the disease that is called tuberculosis. But many of us, we do not have the disease, but we have the bacteria inside us. So it is that very concept. Those who are exposed to bacteria, the treatment to be given is called TB preventive treatment. That's the better part of this one. That's the concept. So I want you to keep that in mind. Okay. So All the people do not develop this TB disease. Why? Because this TB, we say it is an opportunistic infection. It is an opportunistic infection. It attacks only the weaker section of the people, like those having low immunity. If you have low immunity, TB can attack you anytime. That's why there are certain vulnerable high-risk groups, and those are the PLHIVs, people living with HIV. Immunosuppression. If your immunity is down, if you have HIV, then TB can affect you anytime. Then another is malnutrition. If you are not taking proper food, if you are malnourished. Then another one is diabetes. If you have diabetes, then also you can have this TB infection. Then chronic alcoholics, chronic smokers, then children, since they have low immunity. Then contacts of persons, this open pulmonary case contacts. Supposing I have pulmonary TB, my children, my wife, and all my immediate relatives, they are at risk of having TB. So these are the vulnerable groups, high-risk groups. All of us do not develop TB disease. It is said that a person, open pulmonary case TB, he can infect up to 10 to 15 persons per year. Supposing I have TB, so if I do not get treatment, I can infect 10 to 15 persons per year. And it seems without treatment, he will die within 3 to 4 years. But within that time, he can infect that many people. So that's the danger of TB. So all people do not get TB, only those with low immunity. So when we look at TB, all of us are exposed to TB at one point of time or the other. But what is important is your immunity. If your immunity is strong, you will not develop this TB. And the frequency also matters, the duration also matters. How frequent you meet with a TB patient also matters. And the duration, how long you stay with a TB patient, that also matters. Okay. Then if you come to the specifics of TB, we have seen that it's spread through droplet infection. So what are the types of TB? There are two types of TB. Pulmonary TB and the extrapulmonary TB. Pulmonary TB means the lung TB, we call it, no? Lung. The one that affects the lung is called the pulmonary TB. And then the rest of the TB, other than the lung, is called extrapulmonary. Other than the lung is called the extrapulmonary. It is said that TB affects all the organs of the body except the hair and the nails. It affects all organs of the body. TB. So pulmonary is the one that affects the lungs. Extrapulmonary is the one that affects the other parts of the organs. And what are the other parts of the organs that gets affected? One most common is the lymph nodes. TB lymph node. Huh? That is one common. Another is TB meninges, brain. Huh? It affects the brain. Another one is TB bone. Bone TB. Huh? It affects the spines, the bones. Then another one is from our genitourinary tracts. No? Then another one is the reproductive organs. Then another one is the TB abdomen. No? So TB affects, in fact, it affects almost all parts of the body except the hair and the nails. So we have the pulmonary and the extrapulmonary. So how does this TB present? No? What are the symptoms? How do we know that a person has TB? So this also depends on the type of TB. If it is an open case of TB, pulmonary TB, since it affects the lungs, the person will have cough, no? Khasi. Cough is the most important component here, since it affects the lung. No? So if a person has a persistent cough of 2 weeks or more, this 2 weeks, no? We say that 2 weeks or more of persistent cough might be TB. And some other constitutional symptoms associated with these are, along with cough, if a person has fever, night sweats, na? Pasina ular, na? Fever, night sweats, then loss of appetite, weight loss, then tiredness. Despite doing nothing, you feel tired. Then you have chest pain. Then you have shortness of breath. Then you have sometimes hemoptysis, coughing up of blood. If you have this type of symptoms, most likely then you have TB. You cannot say that he is having TB, but most likely cough of 2 weeks or more with fever, then with all the things which I just mentioned. No? If it is like that, most likely it will be a case of pulmonary TB. And what about the extrapulmonary? Extrapulmonary also may have fever, weight loss, night sweats, tiredness, all this along with the organ which is affected. If it is lymph node TB, they will have swelling, cervical lymph node swellings. And if it is of very long duration, sometimes pus also might be coming out through the lymph nodes. And if it is bone TB, they'll have pain or deformity in that particular bone. And if it is to do with the genitourinary tracts, they might have passing out blood in their urine, or they might have infertility if it affects the reproductive organs. Infertility, this also is quite common. And abdomen, they might have pain abdomen, all this. So depending on the type of TB, if it is pulmonary, they will have cough along with the symptoms which I just said. If it is extrapulmonary, they might have all these symptoms along with the organs affected, either pain or deformity or whatever. So these are the two types of TB. The treatment is the same, but from the program point of view, we are more concerned with the pulmonary case. Because like I said, TB is spread through droplet infection. So if it is from the lung, every time you cough out this bacilli, we call it tuberculosis, Mycobacterium tuberculosis, that bacteria. Every time the patient coughs, it brings out so much of bacteria, bacilli into the environment. So we all inhale that. So from our program point of view, the open or the pulmonary case will be more important. Because that is the case that can infect so much people. If it is extrapulmonary, like I said, since it is confined to the organs, it will not be spread through droplet infection. So this open pulmonary case is more important from our program point of view, even though the treatment is the same. Okay, so that is the symptoms. So how do we know that particular patient has TB? It might not be TB, it might be COVID. What I just said, it's almost same with COVID also. Or it might be some other, even typhoid also can be like that. Or even malaria also can be like that. Or they might have some other respiratory infections. So how do we know that that person is having TB? So now coming to the diagnosis part. If a person has cough of 2 weeks or more with fever, weight loss, night sweats, tiredness, everything, most likely TB. But we have to see that it's a case of TB. So how do we do is, we take sputum for examination. Here in TB, we do not do the blood examination. We do only the sputum examination. We take the sputum. Sputum is different and saliva is different. Okay, saliva is the one that is in the mouth only. Sputum is the one that comes when you cough, buttery things that comes out from the lung, that contains the bacteria. So we take 2 samples from the patient. Ideally, one should be early morning sample. Early morning sample before you take anything, that one contains more of the bacteria. So we take one, and then we take one in our presence when they come with the morning sample. So that will do the sputum microscopy, we call it. We'll stain it, we'll do some procedure, and then under microscope we'll see. Nowadays though, we have a higher machine, CBNet or the TrueNet machine. So we do under those things, CBNet and TrueNet. So the advantage there is, even with little amount of bacteria, we can detect that it's a case of TB. And at the same time, we can detect whether it is resistant to a particular drug. Drug resistance also can be found out from there itself. So that's the advantage of this diagnosis of TB. So that's to do with pulmonary. So the most specific test is sputum microscopy. We call it sputum. Then the other relevant things we do is we do for say X-ray. X-ray also it helps in this. And like I said, there is no blood test here involved in the diagnosis of TB. So that's the diagnosis part. So once we confirm that the patient has TB, with all the symptoms, everything, we have done examination and we found out that the patient has TB. So what is the next step? In our program, what we do is we try to rule out the comorbidities also. We try to help the patient also fight the other comorbidities. So if a patient comes to us, we try to examine him, and when we examine and find out that he's having TB, what we do is we do counseling. We tell him about the HIV also, no? Because since HIV is closely related to this, we counsel the patient, and then we ask him or her to go to counselors from this NSEX department, and then we will come to know about their HIV status, whether they have HIV or not. And then we do counseling for him to undergo and see diabetes also, whether they have sugar or not. So HIV, they go to the NSEX, they do free tests. Then for diabetes, they go to NCD for free test of sugar. Then we ask them whether they have any addictions like tobacco, use of tobacco, then whether they take alcohol or not, smoking, all these. No? So if they have all these things, we try for the addiction program. So at the same time, after their TB diagnosis, we try to rule out all these comorbidities also. Like we go for HIV testing, then this sugar testing, then we give them counseling for de-addiction. And remember that in TB program, everything is free of cost. During the course of their treatment, they are supposed to get a nutritional support, 500 rupees every month from the government of India. And that has to be deposited to their bank account through DBT. So before treatment, we try to get their account number, a valid account number, and as soon as their treatment starts, this money, 500 rupees per month, will be deposited to their account through DBT, so that they can improve their nutrition treatment part. Treatment, once everything has been done, we do the treatment. And here in treatment also, TB is a bit different from the other disease. Here we follow what is called DOTS. Directly, DOTS, no? Directly Observed Treatment Short Course Strategy, DOTS we call it. No? Since it is going to be a long duration treatment, if we give the medicine to the patient, we will not know whether they will take the entire medicine or not. So what we do is, we ask the patient to take the medicine in front of us. DOTS, directly observed. No? So this is under direct supervision, they will be given treatment. We will be giving free medicine as well as free support also to this.